Okay, picture this. You're trying to save someone from starvation. You give them food, right? But what if that very food, the thing that's supposed to save them, actually triggers a massive, life-threatening crisis? It sounds totally paradoxical, I know, but it's a very real medical condition called refeeding syndrome.
I mean, how wild is that? The thing that's supposed to save a starving person can also harm them. It goes against everything we think we know. Food should be the solution, period. But when a body has been pushed to the absolute brink, it can react to that food in some really shocking and dangerous ways. So let's dive in and figure out exactly why.
All right, so let's get into the weeds a bit. How on earth does this happen? Well, the whole answer is wrapped up in this sudden, really dramatic metabolic shift that happens inside the body the moment it's reintroduced to food.
So what are we actually talking about here? Basically, refeeding syndrome is just this cluster of metabolic problems that suddenly kick into gear when you start feeding someone after a long period of starvation. You can think of it as the body's over-the-top reaction to a sudden change in fuel. And to really get this, you got to look at two totally different states the body can be in. So, during starvation, the body goes into this ultra-conservation mode. It's what we call a catabolic state, and it's super careful, just sipping on fat reserves for energy. I love this analogy. Think of it like a factory that's shut down and is just running on these quiet little backup generators. But then, refeeding begins, and it's like someone just walks in and flips the main breaker, flooding the whole system with power.
Okay, so what actually happens when that big switch gets flipped? Let's zoom right in, down to the cellular level, and see the real science behind this shock to the system.
It all starts when you reintroduce carbohydrates. The body sees those carbs and goes, yes, fuel, and releases a massive surge of insulin. Now this insulin acts like a foreman, shouting at all the cells to start pulling in key minerals from the bloodstream, especially phosphate. Why? Because they need that phosphate to make ATP, which is, the actual energy that powers every single cell. The result? Well, as all the cells start hoarding these minerals, the amount left floating around in the blood just plummets. We're talking dangerously low levels fast.
And this right here is the absolute crucial point. You have to remember, this person was already malnourished. Their total body stores of these minerals were already scraping the bottom of the barrel. So this super fast shift, pulling what little they have from the blood into the cells, is like draining a nearly empty reservoir. It pushes an already fragile system right over the edge into a full-blown crisis.
The single biggest, most dangerous consequence of this mineral crash has a specific name: hypophosphatemia. It just means critically low levels of phosphate in the blood. And this isn't just some minor side effect, folks. This is the hallmark symptom of refeeding syndrome. It's the big red flag, the thing that triggers almost all of the really severe complications that follow. And once that happens, once the phosphate levels crash, it sets off this terrifying domino effect. The consequences just ripple out, affecting the entire body. So let's just hammer this home. Phosphate is absolutely essential for creating ATP. Again, that's the energy currency for every cell. So when phosphate levels crash, it's not just one system that's in trouble. The entire body's power grid is about to go down. And without that energy, your muscles just can't do their job. This gets really, really dangerous when we're talking about the heart muscle. It can't contract properly, which can lead straight to heart failure. Then there's the diaphragm, the main muscle you use to breathe. It gets weak too, and that can cause respiratory failure. On top of all that, it can trigger some seriously dangerous heart rhythm problems. And let's not forget the brain. That thing is a huge energy hog. So it's really no surprise that when the power goes out, you see severe neurological issues. We're talking confusion, seizures, even a coma. Elsewhere in the body, this energy crisis can get so bad that the muscles literally start to break down. It's a condition called rhabdomyolysis. It's as bad as it sounds.
And believe it or not, the crisis doesn't even stop with phosphate. That same huge insulin surge also messes with fluids and other key minerals like potassium. So suddenly you've got abnormal fluid balance and dangerously low potassium levels, which just makes those heart rhythm problems even worse. It's like adding fuel to an already raging fire.
Okay, that was a lot, and it's pretty scary stuff. So, knowing all these dangers, how in the world do we prevent it from happening? Well, step one is always identifying who's most at risk. And for that, clinicians have some really important tools, like the UK's NICE guidelines.
Yeah, the absolute key to managing this is prevention. You just don't want it to happen in the first place, and that's exactly why having a clear, evidence-based checklist to spot high-risk patients before you even think about starting nutrition, well, it's just incredibly important.
And this table here lays it all out pretty clearly.
So a patient is flagged as high risk if they have just one of the big things on the left, like a super low BMI or haven't gone more than 10 days without food. Or they're also considered high risk if they have two or more of the criteria on the right. That includes things like a history of alcohol abuse or slightly less extreme weight loss. This checklist is an absolutely crucial tool for doctors and nurses on the front lines.
So, let's say a patient is identified as high risk. What's next? How do you actually prevent the syndrome? Well, the strategy is, believe it or not, surprisingly simple. It's all about a slow and safe return to nutrition.
The mantra here, the guiding principle, is just beautifully simple. Start low and go slow. That's it. Instead of just blasting the system with a flood of nutrients, you give it a chance to wake up and adapt.
And the NICE guidelines get really specific about this. They say, look, if a patient hasn't eaten for more than 5 days, you should start refeeding them at no more than half, 50%, of what they actually need for the first couple of days. And by doing it this way, by reintroducing food gradually, you let that hibernating factory come back online nice and slow. The insulin response isn't a huge surge, it's more of a gentle rise. The mineral shifts are way less dramatic, and you completely avoid that catastrophic crash we were talking about earlier. You're basically giving the body a chance to safely and slowly reboot its entire metabolic system.
So this all leaves us with a pretty powerful thought, doesn't it? Refeeding syndrome is this incredible reminder that in medicine, and honestly probably in a lot of other things too, the most aggressive, full steam ahead approach isn't always the best one. It really shows us that sometimes the real path to healing requires a bit of caution, a lot of patience, and just the wisdom to understand that sometimes less really is more.